Hi everyone! Today I'm back with my 3-month pregnancy update, weeks 9 through 12. For me, that lined up to July 17th through August 13th. Let's just get into it. So I will follow the same order as I always do, have that listed below. Due date, February 18th, question mark. So I had my first OB appointment, so I'll kind of get into that. But so February 18th, so it was month 3. Most of our family knew, but by the time we hit that week 12, after we had our first OB appointment, it was kind of free game for everyone to know. We didn't quite post it on social media yet, but it was kind of like, if people know, people know. But a lot of people already knew. So the food sizes we went through were a large kidney bean, week 9, week 10, green olive, week 11, a fig, which I don't think I've seen a fig, and then week 12, a lime. So back to the appointment. I finally had my first appointment. It was for what I had calculated week 12 and 6 days. So the next day I was flipping to 13. My OB had wanted to see me between weeks 10 and 12 for the first time, so that was our first appointment. Nate came with me, so that was nice. So she calculated the same due date as me. I was just seeing a PA, my normal PA, because we had known we would be moving. So I just thought it would be best to stick with her since I'll be finding a new provider once we move anyway. Right now, Twiggy? Let's see how it goes, okay? I'd rather her do that than fix it. Okay. Yeah, so she calculated, my PA calculated the same due date as me, February 18th. But then when she had me on my stomach, or on my back, and was feeling my stomach, she said, your uterus feels large. And granted, that day I had been holding my bladder like all day because I didn't know what labs that would need to be done, and it was like towards the end of the afternoon and whatever. And so I hadn't done those labs yet, and she was surprised at how quick she found the heartbeat, so she had wanted to refer me on for an additional ultrasound to determine dating, and I wasn't really comfortable with that. She explained, because we asked why that would be important, to which, like if you kind of make the difference for if you went early and you had a preemie according to the dates, or if you're going late. But I don't know, I just thought, what's the difference between doing it at like 13 weeks and when we just get our anatomy scan? So I opted out for that, which I'm glad we did, because then later a lot of other people, women who've been pregnant, had told me that their insurance had only paid for one, and they found out about that after having two, and it seemed unnecessary. So we were curious about doing the gender blood test as well. I've seen a few bloggers have that up, and my friend Dee Dee told me about it, and so we were curious about that, because I mean, how accurate is an ultrasound compared to that too? Like, there's always room for error, but she didn't know much about that. She didn't know anything about that, so we were like, okay, fine, we'll just do the ultrasound in a few weeks. I asked about sandwich meat. Of course, I don't even care about deli, turkey sandwiches. And all I really wanted first trimester was a turkey sandwich. And I was erring on the side of caution, not eating it, but she was like, eat whatever you want, do whatever you want. I mean, there are certain things you're supposed to avoid, but if you have your coffee normally, go ahead and do that. Go ahead and have the sandwich meat, exercise how you normally would, that sort of thing. So then she did recommend like a Lamaze type class. Later on, about 28 weeks, we will be doing hypno babies instead, which is different than hypnobirthing. She just reminded us to try to look for childcare now because it fills up around here pretty quick, but we are leaving the area and we have our provider who is our friend, so that's nice. Then she kind of just laid out the schedule for me, saying that they would do every 4-week visit until week 28, then they would go to every 2 weeks until 36, and then weekly until a baby comes. So the exciting part, of course, of all of this was hearing the heartbeat for the first time. I didn't cry. I almost wanted to, but I didn't. So Nate and I thought that was really cool to hear. It was about 160. She doesn't tell me exact. I don't know if they see exact on the Doppler or what, but she said it was about, help, okay, about 160. So does that mean girl? I don't know. That was the first appointment, and I thought that went pretty well. It was a very long appointment, about an hour. There's just a lot of background stuff to get through. That's kind of it. That's it for appointments. So weight gain or loss at that appointment, I was 148 pounds, which was about 6 pounds up from beginning of the first trimester. Bump date, I will insert pictures now. I started feeling pretty chubby towards the end here, just myself starting to feel like I was gaining a little weight in the tummy area. So symptoms, they keep coming. Month 2 is pretty good, but they keep coming. So the tender breasts have continued, and growth for sure is something we have noticed. Bras aren't comfortable, so I don't wear them at home, but I wear them to work, but they're too small, yada yada. More on that in month 4. Week 9, going into switching from month 2 to 3, I had a huge panic. No, I don't have panic attacks. I had a huge like anxiety freak out moment. It was a whole night of it, and Nate just like wasn't having it, so it was like even worse. He was just like wanted to sleep, and I was like, no, we're gonna clean the house. I just took on a huge project that ended up being a mess. And at that same time, we had to have decided on moving, but I still hadn't found a job. Just all this uncertainty about being a millennial, and I just fits of crying, rage, just the worst. And after that night, it was okay and continued to get better. So no, I think we didn't know, because we didn't know if we were moving yet. So I was just like, what am I doing with my life? Because my job here is temporary. It was kind of dwindling. Whatever. So many external factors. I don't even know if it had much to do with the pregnancy, but I really laid into my emotions that night. This month is when my extremities started to get like kind of tingly. Maybe I'm like deficient, but yeah, like if I'm laying in a certain position too long, my extremities have started to get like a little crampy. So I don't know what that means. Nothing really bothersome, but it's just something I noticed. One night I felt kind of feverish and allergies. Another night I took loratadine. I kind of have been marking that because I don't take meds often. But I did take loratadine one night. Category B. I started to notice my ligaments stretching and pulling when I sneeze or blow my nose. That's uncomfortable. Please let me know if that's happened to you, because I always think it's the worst. I like think I have a hernia or something, but I'm sure it's just like a quick jerk movement that makes that happen. Sorry, I never look at you. My notes are like down here. Every once in a while, I started to get like heart palpitations sort of when I was laying down usually. Just like, it's almost like I can just like for a few seconds feel the blood actually pumping. And it kind of feels like fast and not regular, and then it goes away just fine. Great. Week 11, I dreamt of having a healthy baby boy. It was a whole dream. It was wonderful. But he had difficulty latching, so I don't know what that means. That was like a huge deal in the dream. But I remember just being like so happy to hold him. So, who are you, baby? I don't know. This is the month that my skin started to break out, about week 10. And it's not just my face, it's my chest and my back. So that's been fun, and I feel beautiful. Yeah, I don't really know what to do about that. When Nate's home, his favorite skincare product is 91% isopropyl alcohol. So that is what we've been putting on if he's home to like reach all the areas. Otherwise, I'm just dealing with it, I guess. So yeah, great there too. I did have a dizzy spell at work one day in the morning. I think I just didn't eat. I mean, I didn't eat. I think I had like a little baby Pop-Tart or something. Twiggy, not right now. So that wasn't good. But as soon as I ate something and sat for a minute, you know, the vision was kind of closing in, felt a little warm. As soon as I ate, I felt better. Cravings and aversions. During this time, towards the end of this month, that third month, I wanted to have red meat more. I wanted burgers and I wanted steaks a lot. So I didn't really miss much of anything that I wasn't already missing. Exercise, continued walks with Twig, not really ramping it up there, so that continues. No stretch marks, no swelling, no sleep issues, couldn't feel movement yet. Maternity clothes, I just started buying a few like dresses. Excuse me. I started to buy a few dresses. If my pants felt tight, I would just unbutton them after lunch or like use a ponytail to kind of open it up a little more in that area. But yeah, that's that. Apps and aids, I started a notebook. You know I can't get through anything without having a notebook for it. So chapter 2 doesn't really fit, but I'm trying to use up my notebooks. So I have a few sections here. Topics to research. Hello. Then we have the actual research on the topics. And then the pink was supposed to be like filming notes, but I'm really mostly keeping them in my phone, and then I just bring it to appointments if I want to jot some things down. So I started using a notebook. Bought and received. Mother went out again and bought, we call these pluggers. What are these, like pacifiers? Purple to be neutral. So that's that. She bought that. My coworker gave me the tip. She said she buys, or used to, when she was pregnant, a package of diapers every paycheck. We haven't quite been doing that because I don't know how it's going to go yet, which maybe can be something we kind of discuss. So we want to do cloth as much as we can, like at home and that sort of thing, and then try to only use disposables when we're like going out and about. But so I don't really know how many to buy, at least of like newborn. So that's something I have to figure out. But so I'm not going crazy buying every paycheck, but I did start picking up newborns. This pack is from Anna's company. Goes up to 10 pounds. There's 34 in a package, about $11.99 at Target. So yeah, I'm gonna be one of those moms too, which is kind of hard. Like, it's been, how do you tell family people that you want to be particular? But my friend had a really good suggestion. If we get, you know, a brand of diapers that I'm not quite into putting on my baby's skin, we can just donate them. So yeah, so I got these Honest brand. So today I picked up Baby Organics, which this is a pack of 36 for the same price. Basically the same thing. Chlorine-free, premium fit, ultra soft, plant-based absorbent made with natural and renewable resources. So I don't know what's better. I don't know what I'll like better. I don't know if you have an opinion. So diapers, tell me about it. I've heard a gauge of like 8 a day. That would be like max though, is what I'm hearing. So I'm set for like what, like 8 days, 9 days, and then I don't know which cloth diapers. I'm doing more research on cloth diapers. I haven't reached my consensus on which to buy and that sort of thing yet. So if you have diaper information, flood me. So that's what I picked up. Materials, lots of materials. So coworkers started giving me things. This is my coworker's pregnancy book, but I go to the same hospital or where, what? Clinic. So it's like updated, I guess. So I haven't looked at that. I looked at the one we received, but I felt like it was stuff I knew or stuff that I would need to refresh on later anyway. She had lent me the perfect baby name, but we have our names. She also gave me what to expect when you're expecting, which I had purchased the what to expect like before you're expecting or something and read that, but I haven't read this, and I'm honestly not sure I'll get through it because my app is really, I mean, I have the app, I guess, to this, which is more of the newer age thing people would be doing. So I haven't really gotten into this because my app updates me with emails, and they have articles on the app too. And then child passenger safety. Yeah. Those were given to me at the doctor's office. But my coworker did give me, low battery, hello, baby's first year. And I mean, I'm gonna keep it. I'm not quite sure we'll use it, but it comes with like stickers and things. Crawled, stood alone, first haircut, foods I don't like, blah, blah, blah. So that's cute, but I'm not sure how that'll fit into my planner life, if I'm just gonna keep it all in my planner or what. So those were kind of the things bought and received for month 3. And then discussion resources. I just have been Googling a lot of things. The research I've done that month was on delayed cord clamping, and in a way that's versus cord blood banks, and what we've decided on that is to go with what the WHO recommends, which is delayed cord clamping for 1 to 3 minutes. So if you're into that, ask your midwife or your physician, make sure because that's something that they mentioned in the articles I read, that, you know, like something very minuscule but important, and like if you don't ask for it specifically, they may not do that. So delayed cord clamping is basically waiting 1 to 3 minutes versus just like cutting the cord within the first minute. If possible, babies get that extra blood that could help with anemia in the first month. The main reason they stopped doing it a long time ago was they thought there was an increased risk of hemorrhage, but there is not. They have found that is not true. So the con I found to that would be increased risk of jaundice, 2%. So it kind of in a way goes against cord blood donation, because you would need that cord blood for the donation, which I didn't find there would be too many upsides to that. I'd rather just have my baby get the blood right away. So that's what we are going to do. And the way the research is working for us is I basically research and take notes and present it to Nate like that, and he says, okay, that sounds good, or I have more questions about that. So that's kind of how we're doing things. So yeah, that's everything. Can you let me know about diapers? If you have advice, things to say about diapers, that would be really awesome. You can find me on Instagram. You can find me on the Twitter, Facebook. I'm on there, but you know, or just talk to me here. That's cool too. I can't wait to talk about month 4. I feel like even more happened in month 4, and we like are I feel like actually pregnant, and you can see my bump more. So thank you for watching. Really appreciate it. Thank you for receiving these videos well. If you're new to Tiny Tour, hi. A little bit about me besides being pregnant. I'm a pharmacist, a newly graduated pharmacist, and I'm a dog mom, and I'm a wife, and that's kind of my spiel. So if you're interested, please subscribe, and I'd love to see you every week because I've been pretty on it every week. So thank you, everyone. I will see you next week. Bye.